Hello everyone, I am Dr. Ashutosh Daga and I am working as a medical oncologist in AMRI Hospital, Dhakuria. So, when we talk about cancer, we have uh, kind of very bad thoughts or very poor thoughts which come to our mind. We have nightmares when we talk about this disease. So, first of all, I just want to say that cancer is just like a other disease. We have made a lot of progress, we have made a lot of strides regarding the cancer diagnosis, early pickup, its treatment, and its outcome. So, first, by this video, by this talk, I just want to make all of you aware that cancer is not untreatable nowadays. The sole motto of reaching out to you guys is how can we prevent cancers today in our life by doing small things so that we can, not only us, in our family, in our society, how can we make a change so that we can actually prevent, we actually make us safe from having cancers in future. So there are very small things which we can do on a daily basis. If we start from the lifestyle thing, because these are the things which we can change, because cancer is a thing which has a complex uh, connections between various things, and ultimately that happens in our body. So there are preventable things and there are modifiable things, and there are things which we cannot modify. So non-modifiable things, usually we have our genetics or gene or DNA, like that we cannot change that, but there are things we can change so that we can alter the course of having a cancer in us or in our family members or in the society. So if we talk about the prevention of cancer, the most important thing is the lifestyle changes. When we talk about lifestyle, not only it is about a simple thing like the food habits, it also incorporates our daily physical activity, our daily exercise activity, and the addictions which we, some of us, will have in our life, how that affect us. So if we talk about the food, yes, taking a portion of fruits, healthy veggies, avoiding too much of carbohydrates in our food, all these things make a healthier lifestyle. This will not only prevent us from cancer but also other diseases like heart disease, blood pressure, cholesterol, diabetes, and many other things. If we incorporate at least minimum 30 minutes of vigorous exercise, so that makes up almost 150 minutes a week. So if we do that on a regular basis, this is also a thing which help in preventing us cancers, because obesity and exercise, these are one of the important risk factors for many of the cancers. If we talk about addictions, like many of us in our family members or we ourselves are smoking, it is one of the biggest risk factor for the lung cancer nowadays. So if I talk about lung cancer, if there are 10 patients with lung cancers, 9 will have a history of smoking at some point of time. So that is what the burden of smoking related lung cancer is there. Apart from not only lung cancers, there are many type of cancers like head and neck cancers, like bladder cancer. These are the common cancer which we see because of smoking. So it's just a very simple thing. By quitting smoking, by stopping smoking, we can prevent ourselves, our family members from smoking related cancers. What we do directly is active smoking. When somebody smokes in his house, not only he is putting himself or herself at risk, the kids, any person who is coming in contact with that smoke, that is known as passive smoking, becomes automatically a risk factor for cancer in future. If I talk about alcohol, so alcohol has been a risk factor for cancer. Most important of them is the liver cancers. So if somebody takes alcohol in a regular basis on a large amount, that will lead to liver related problems. The liver will get completely destroyed. So it will not only lead to cancer first, it will lead to a completely destroyed liver, that is we known as chronic liver disease. And on top of that, some people will develop uh, uh, hepatocellular carcinoma, means liver cancers. So these are the things which we can normally do to prevent cancer in ourselves or to prevent cancers in our family members or society. If I talk about the genetic things, usually we have a lot of patients who have a very significant family history, like in their grandfathers, grandmothers, or in their family there are a lot of cancers going on every generations. We as a doctor need to find out first the history related to that. We need, as per the history, we advise genetic counseling followed by genetic testing of such patients. So if a patient is having cancer and we pick up any germ lines means which is present in his or her DNA, and that particular gene can be passed on to his or her future generations. So if we pick up any of these genetic related cancers, like in breast cancer we have BRC related cancers that causes breast cancer, ovary cancer. If we pick up that, then automatically we do a genetic counseling of the family members of the patient's daughter or sons, so that they can also get genetic counseling followed by genetic testing. And if they also turn out to be positive, we can do certain things which can prevent future cancers in those particular people. So there are a lot of things which can be modified or which we can put them under surveillance, so that if at all we can reduce the risk of cancer, and if at all they develop cancer, we can pick it up at the early stage. This is just a very brief thing which I have told you about the cancers. Cancer is a very complex disease, but at the end of the day, it is treatable. Even stage 4 cancers have treatment now, and these kind of patients can live for years. So my message to the whole society and anyone who is watching this video is, don't be afraid, get out of your home, consult proper people, specialists, so that you can get a proper guidance. Thank you.